I'm Dr. Mark Gross. I practice at Illinois Bone and Joint Institute in Barrington. I've been in practice in this area for 35 years doing orthopedic surgery, in particular spine surgery and spine-related surgery. We're going to be talking about sacroiliac problems, specifically something called sacroiliitis, which is an inflammation of the sacroiliac joint, and talking about various treatment options, including possible surgical solutions for the problem. So the sacroiliac joint is a common cause of pain, much more common than people realize. What the sacroiliac joint basically is, it's a joint where the pelvis connects to the spine. In essence, it's the only bony attachment of our upper body to our lower body, so it takes a lot of stress. Typically, the pain is in one very specific area, though it can have many manifestations of pain in other areas.
My pain with the SI joint started probably when I was a lot younger and just progressively got worse after having children. And I think it got a lot worse, it was very debilitating.
Getting out and walking around a pond or sitting down on a boat for any length of time, or driving a car, or sitting at a table, or walking in a mall, you name it, it was bothering me. And so a lot of those things I couldn't do, but once I had the surgery, I was able to do those things more readily. I can drive for 3 or 4 hours in a car now, and it doesn't bother me. I can sit here on this bench, and it doesn't bother me. In that respect, it was a great success.
I wasn't able to even go to the movies with my kids and sit for more than 2 hours. And after I had the surgery, that was one of the first things that I did, was go to the movies and be active and riding bikes and just going for a walk with my kids.
So when we have people come in with low back pain, and particularly people that you're suspicious of sacroiliac problems, you still do a comprehensive exam. So what we do is we examine the spine, we examine the pelvis and the SI joints, and we also examine the extremities. And this is very important because things can mimic each other. There can be a crossover. You can have two different conditions. We then do different types of stress tests, like it's called a distraction and a compression test. We're actually pushing the pelvis together and pushing it apart. And then we have other maneuvers where we're manipulating the leg. Once again, not even testing the SI joint, but it can precipitate their pain. And these are tests that are specific for the SI joint.
So I called over here and came in for an initial consultation, and then they did an examination. They even did a couple of diagnostic SI joint injections to clarify that I have an SI joint dysfunction.
So when I fuse the SI joint, I use a product called iFuse. It's got tremendous track record. The reason I use it is because it's, number one, it's very reliable. It's very predictable when you're putting it in. And then we're basically putting 3 implants under X-ray guidance across their sacroiliac joint to fuse it. Now we usually use a pretty small incision, 2 or 3 centimeters. This is all done from multiple different angles on the fluoroscope, so we can see it going in different angles into the pelvis. The procedure basically is done through that small incision right on the side of the buttock. Typically the procedure takes less than an hour, around an hour. What we do then is we have them on a walker initially, doing partial weight bearing. People can use crutches. Most people prefer the walker because it gives them a little more freedom with their hands when they're standing around doing things. There's usually a visit at 2 weeks. We reassess them, get an X-ray. If things look good, then often we're advancing people to full walking shortly thereafter. Patients do very well. It's a minimally invasive procedure, so they don't have a lot of side effects, and the predictability, the reliability, and the known effectiveness of it is why I use it.
Now that I've had the surgery, I can take walks. I can go hiking in the woods in front of us because we live on Conservation District land. So I can take long walks around there. I can stand around the pond and fish. I can sit on a boat or sit in my car for a lot longer. I can sit down for a lot longer where I could not do it for any length of time before.
iFuse gave me back my life because I can be free of that pain. When you have SI joint pain, it just controls every aspect of your life. And now I can just go about my day and do normal things. I would recommend it for anybody.
So if patients have problems that they think might be related to the sacroiliac joint, or particularly if they've had previous spine fusions, I invite them to come in to be evaluated. It doesn't mean you're going to have a sacroiliac joint problem when you come in, but that's part of the thing I consider. And as I mentioned, often patients that do that now find the reason for their chronic pain and a solution for it.